Dr. John here with my podcast, Integrative Health Insider, which is actually promoted by my company, Advanced Integrative Health Center, where we focus on all things chiropractic, functional neurology, and functional medicine, and we integrate all of this information into patient care. And that's our goal with any patient coming into the clinic, is to get to the root cause. I mean, I get people coming in with back pain, and they can have neurological-based problems, and they can have weight issues, and they can have blood sugar issues that can cause pain. So our clinic is all about integration in lifestyle for a health span and a lifespan that go together, so that when we get to that, as Peter Attia says, we get to that marginal decade, that last 10 years of life, we're not falling apart and on 12 meds. We're strong, we're healthy, and then we kind of come to the end within a few months and not suffer for 20 years, which is the current conditions that people are in. So we're going to pick up some more concepts about longevity, health and wellness, tied into slowing the aging process down, and how that also affects the buzzword out there of Alzheimer's, dementia, Parkinson's. Again, age-related changes into dementia and Parkinson's and Alzheimer's is a growing problem in this country and worldwide. Alzheimer's was, this little overview, Alzheimer's was identified and labeled, in 1906 with one person. And by the time we're at 2025, we have 7.2 million people in the United States suffering from neurological disorders of the brain. And another 2 decades, or excuse me, by 2060, 2060, don't quote me. It's supposed to be 15 million people in the United States, and globally 50-some million worldwide. It's a staggering number of people suffering from these conditions. And a vast majority of these are really lifestyle problems that we're doing to ourselves. We give ourselves, it's like type 2 diabetes. You don't have a genetic problem for type 2 diabetes. You eat yourself to type 2 diabetes. And it looks like on some level, Alzheimer's is the same way. We certainly have a gene that you can identify, the ApoE4 gene, ApoE3, ApoE4 combinations. They'll add a little bit of influence to the problem, but the vast majority of brain problems that people are having are really lifestyle. And again, just to review some concepts, the biggest lifestyle we have is blood sugar, just constantly eating. And our bodies aren't really designed to constantly eat food all day long. We do best when we have intermittent fasting. I personally promote in this clinic 2 meals a day, lunch and dinner, with nothing in between. I seldom ever eat breakfast unless I'm traveling. And when I do eat, it's usually going to be some form of some eggs with a lot of vegetables on the plate. I don't do potatoes because of the glycemic index. So it's just too much sugar, and the starch goes to sugar too fast. But the key is with the intermittent fasting, which promotes the body's ability to clean up what we'll call autophagy. It takes stress off the mitochondria. It takes stress off the immune system, and our body has a resting phase when it can repair and clean itself. And then through the intermittent fasting and surface vegetables and healthy eating, we lower our blood sugar, we decrease our insulin resistance and increase insulin sensitivity, which are all longevity factors that help us fix our metabolic system, but increase aging and decrease Alzheimer's, dementia. And again, tying with that, with the intermittent fasting and getting rid of the insulin and blood sugar problems, we actually end up lowering chronic inflammation. Low-grade chronic inflammation is really becoming a leading reason for all-cause mortality. It causes chronic low-grade inflammation that your body cannot resolve due to lifestyle, creates heart disease, high blood pressure problems, insulin resistance, glucose problems, type 2 diabetes, autoimmune problems, and the list is big. So the chemicals and inflammation, if you decide to read some of this stuff, inflammation is it's caused by a class of chemicals. They're called interleukins, and that's one type. And you'll see it in the literature, interleukin 1, interleukin 6, interleukin 8, tumor necrosis factors. There's a bunch of them. But taking the time to understand what these molecules do to our body and how they create massive amounts of inflammation. The key to realizing this inflammation is it's not tissue specific. You can have an autoimmune problem. Let's say the most common one for females is Hashimoto's thyroiditis. But the inflammatory molecules, the cytokines that are creating the problem from inflammation, are also spreading throughout the rest of the body. they're not tissue specific. They just spread with blood and they go everywhere. And this is why autoimmune problems turn into more autoimmune problems and turn into more health conditions. This is why it's important that from a lifestyle perspective, we start getting rid of chronic inflammation. How do you do it? Intermittent fasting, the whole food nutrition, on the 2 meals a day, the downregulation of glucose and insulin. See, all these things stack with each other. And again, you can add nutrition to help with that. Certainly, nutrition like turmeric and resveratrol and glutathione supplementation and N-acetylcysteine have been reported in the literature to support the lowering of inflammation. That's important, your essential fatty acids as well. So just the adding of that nutrition with lifestyle changes has a profound effect on inflammation, which also has another effect on another pathway, which is our mitochondrial dysfunction. So mitochondria are little energy packs, the little battery packs in our cells. Each cell has between 5,000 to 10,000 of these bad boys in them. They're just little batteries. But the systems, when the body is chronically inflamed and you get a lot of oxidative stress, those mitochondria die. And you feel it as fatigue and tiredness. You can't endure exercise and long-term walking. You just get tired because the mitochondria we have in our cells make energy, and your body globally every day makes and uses, on some literature reviews I've read, up to 86 pounds of ATP, adenosine triphosphate, is made and consumed in a cycle all day long. And you clearly don't put on 86 pounds a day, but your body's burning that much energy and making that much energy from the food you eat. It's a staggering amount. So if you're burning and using 86 pounds of these molecules to stay alive, what happens when they can't make the ATP? I'll let that sink in for a little bit. This is where people start having health issues. The body can't run. And so ATP production loss is because mitochondria die, and mitochondria die because of chronic inflammation. And so how do you solve that? Again, that brings us back to intermittent fasting, letting the cells rest. And then as we do get older, we lose some function. So adding some nutrition there like coenzyme CoQ10, key enzymes or key protein molecules like lipoic acid, alpha lipoic acid, and L-carnitine. Those are picked up by the mitochondria to make energy. Little biological hacks you can try. And of course, you should read about those and learn about them. And they help with cellular repair. Moving into the next level, of course, is nutrient deficiencies. And again, we're going to come full circle. Nutrient deficiencies, like all your B complexes, like B1, thiamine, B2, riboflavin, and you got niacin, you got folate, folic acid, you got B12, cobalamin. When you're not eating well, your B complexes aren't in the system. Well, B complexes run metabolic reactions. All your B complexes but one run your Krebs cycle, which make three molecules that get shifted over to the mitochondria to make your energy. So a refined diet, and it's not whole food meaning surface vegetables, lightly steamed or lightly cooked, and rich salads and lots of color. Those phytonutrients are rich in the B complexes and other bioflavonoids that our body needs to run. And so we need to look at magnesium deficiencies and mineral deficiencies like zinc, copper, iron, vitamin D, and magnesium. All of these, we need these foods to run our body. They're not there for fun. So again, when you have nutrient deficiencies, you have mitochondrial dysfunction. And when your body feels that nutrient deficiency, it's going to ask for more food. So you never feel satiated because you're always trying to feed the body the fuel it needs. And since you won't eat whole food, your body never stops eating. And one day you wake up and you're 70, 80, 90 pounds overweight. And now you have heart disease, high blood pressure, type 2 diabetes, probably multiple autoimmune problems going on. And you're wondering why you don't feel good. And of course, you can go to the medical model and they got a drug for everything. I've got one recommendation: stop eating. Use intermittent fasting. Get whole food in your body. You see, you can make profound healing changes. Then once that's done, what's left is what you maybe need a medication for. But again, nutrient deficiencies cause a whole host of problems. We don't have a macronutrient starvation in this country. We have a micronutrient. Nutrients, proteins, carbs, and fats, this country, 50% of the population is overweight. That's a macronutrient problem. But those 50% are also micronutrient starving to death. So keep that in mind. The next level of care that we can begin taking care of our bodies with and slow the aging process down and decrease Alzheimer's risks or dementia risks, of course, is quality of sleep. Are you getting 7 to 8 hours a day? Or are you staying up all night because you can't sleep and you've learned behavioral patterns to not sleep? Those are real issues. We see people in this clinic who learn that they go to bed at 8 or 9, they can't sleep, and then they start laying in bed and looking at the blue screen trying to read, just teaching your body patterns on what's normal. And you really have to break those patterns. You should be going to bed at 9 to 10 and sleeping 7 hours. And if you have to be at work at 6 o'clock in the morning, you should go to bed earlier. There's nothing on TV intellectually stimulating anyway. You get that from books. Well, really think about your sleep quality. Is it interrupted? If it is being interrupted, some of the research says that if you're waking up at 2 or 3 in the morning and you can afford to sleep more hours, within 15 minutes, 20 minutes, you're not falling asleep, don't start looking at your phone. Just get up and get out of bed. You cannot, if you start staying in bed and reading and watching a Netflix show in bed or whatever you're going to do, you're just programming the brain a new behavior and it will adapt that behavior and it will do it quickly. So be mindful. If you're not going to sleep and you don't feel like you can go to sleep, get up, grab a glass of water, sit out on the couch, meditate, relax, see if you get sleepy again, then go back to the bed. Keep that in mind because we need that sleep for our brain to clear out. We have a lymphatic system in our brain called the lymphatic system, and we need that system to work. And it works at night when we sleep. And so if it can't and it's not doing its job, you can build up plaques in the brain. If you have the susceptibility, like the ApoE4 genes, you're increasing the risk of Alzheimer's and vascular type of Alzheimer's and just getting the risk going. So we want to take care of all parts of our body. Then, of course, we have the cardiovascular health. And of course, inflammation hits the heart hard. Again, that's the sedentary lifestyle. One of the things I do in my clinic is, and it's just getting people after dinner, go for a 20-minute walk out, find a location, even if it's a neighborhood. Don't go for a stroll, go for like a 15 to 20-minute power walk around the neighborhood. In other words, you walk, if you can, you walk as far as you can in 15 to 20 minutes, and you turn around and walk back. And getting the habit of doing that, and then more on the weekends, is a great way the body loves movement, and it protects the brain. Then the other thing, and of course, not eating those sugars and not eating all the time lowers your triglycerides, lowers your bad cholesterol. And that has a way of course, protecting the heart and protecting the brain. Those are all important aspects to do. Personally, I like if you have a elliptical trainer at home or you have a bicycle, stationary bike, or a treadmill. I do HIIT training almost every day, high intensity interval training. I use elliptical and I only do it for about 20 minutes. I warm up for a minute and then I burst for 30 seconds and I cool down for 30 seconds. And then I burst for a minute and I might cool down for a minute. Sometimes I burst for a minute as fast as hard as I can go for a minute, minute and a half, and then I might cool down for 30 seconds. I've been doing it for so long, I have to vary the intensities. So HIIT training is a great way to improve one of the markers for longevity, which is your VO2 max, really taking oxygen. If you're older and can't climb a flight of stairs, you're in trouble. So a good marker is being fit enough as we get aging. Instead of taking the elevator, can we take the flight of stairs? Can we climb those stairs and not be winded? Best way to not be winded is you got to exercise the heart, you got to exercise the lungs, you got to go for walks, you got to do HIIT training. I'm not a big fan of hard running. I like elliptical trainers because it takes the stress off the knees, but we're getting that heart rate up in that 80 to 85% maximum range, and we're getting that exercise and we're doing it every day. And like I say, I focus for about 20 minutes a day, and then I do the weightlifting. And by the way, strength and how strong you are is also another marker for quality of life aging as we get older. And the best way to do that is to lift every day, which is what I try to do. But lifting every day isn't going to a gym and doing 20-pound workouts and thinking I'm lifting. Lifting is getting to that 70% max, pushing those boundaries a little bit. And let's say you're 70 and you can go to Planet Fitness or whatever, and you can do 20 pounds, and and it's hard for you, say it is, but a couple times a week you push to 25 or 30 pounds. and whatever your exercise you're doing. But see, you keep tapping that ceiling a couple times a week, and you'll slowly start stimulating strength. Because see, strength is an indicator of whether you're gonna how the number one problem that seniors have is falling. The indication that you're gonna fall successfully is if you do fall, is how strong you are. And if you don't have the strength, that's when you get injured because the natural tendency is to grab. And if you don't have the strength to hold yourself when you're falling and you break something, and I got to look up the actual statistic, but above 70, if you break a bone, there's a 30% chance you're not going to be alive within the first year. So the best way to do that, to avoid that, is having muscle strength, grip strength, toe strength. That means working out. Even if you don't like it, it leads to quality of life so that when you get to that marginal decade, that last 10 years, you have the strength to be alive. And then you get to walking and the cardiovascular strength. You have the endurance to climb stairs, to move around, which is critical. Because the number one problem is falling. If you don't break a bone, either you do or don't, but you survive it, you still risk losing independence. And the best indicator that you're not going to lose independence is how strong you are and how well you can move. So that all ties back to overall physical health, which typically the more mobile you are, the healthier your brain is. Which brings us to another thing we need to do, which is exercising the brain. How do we do that? By learning new subjects. My favorite area is colonial American history. I have a lot of books on it. Every so many years, I would say, if you find a subject you like, you should be reading about it. But you have to find, if you want to exercise the brain, you have to find a subject you know nothing about. And then you start reading it and you start buying the books, you listen to podcasts, whatever it is you want to learn about, you see has your interest. Then you practice some recall. So I like colonial American history. I have read lots on it. At this point, I probably should find another subject to learn about. But that's how you exercise the brain. Then I would work on what was the chapter about that Washington did and what Adams did and Jefferson did. And I try to do the memory recall. So I learn what the American history was about at that time period. And you can do it on any topic and it's good for your brain. And the other thing you do is games. There's lots of apps out there to exercise the cognitive domains of memory. One of my favorites, and I'm not getting paid by them. I don't get an endorsement by them, which is Brain HQ. It's got lots of clinical work behind it to show the value of it, how it helps the brain. I use it in the clinic. My point to new patients coming in that direction to get their own subscription. It's a good tool to exercise the brain. So by doing brain-based games and then continuing learning, you support brain function. And then, of course, exercising and cardiovascular supports blood perfusion to the body and gets blood going to the brain, which allows it to heal. Again, everything is full circle here. A more complicated one now that we're seeing in this world is toxic burdens. And that is because of so many chemicals in our environment and heavy metals and molds. In Michigan here, we see lots of mold. They do lots of mold testing and it shows up quite a bit. It can be a problem, especially black mold. So in testing in the labs that we do screen for molds. And we do try to help people detox out of those and clean it up. You see mercury, lead, aluminum poisoning, and even Flint had the lead issue a few years back. Even here we are in the modern world, you're still seeing issues with water. And then, of course, water isn't always the cleanest. As much as they try to, there seems to be a lot of chemicals in it. So in our house, we use a water filtration system, clean water. We also use infrared saunas for sweating and detoxing. And of course, if you want to be proactive, you add compounds like glutathione and N-acetylcysteine to help clean up free radicals and keep the body clean. And then as much as possible, be careful with the chemicals that you're using. If you love the green grass, be mindful of the chemicals that you're using. When it says wear gloves, you probably should wear gloves. Those chemicals, they'll kill weeds, they'll kill bugs, and they might kill you. So be mindful of the things that you're doing and practice good safety so that you're not giving your body a toxic burden it has to deal with. So what are we've talked a little bit of mental engagement. I want to go back to that a little bit. A few points also that I want to mention. There's the learning that we can do. There's the reading of books, the watching of documentaries of subjects you don't know about to engage the brain. But if we're older, 70s, 80s, we want to be, or young, be careful of mental. The big brain thing here is social isolation. And we want to make sure that we're not doing that. You want to make sure that people who live longer are involved socially, involved not only with family, but events and things they like to do. I don't care what it is, find one. Charities, anything you can do to keep the brain active and learning and engaged with friends and family and do social things so that your body has a chance, so you're emotionally, you feel good. Happy people live longer than angry people. So that mental engagement, and that movement, and that social connection is a big one for healthy aging into the marginal decade that we're all going to hit eventually. And the big one too, with social isolation can be stress. And stress is a big one because stress hits the immune system. The cortisol, which is the stress hormone, can dysregulate your whole body and create all kinds of health issues. So I always talk about another brain-based therapy we can do, but also overall healing for the body is to decrease stress. So guided meditation is a great tool for that. There's lots of apps out there. In this clinic, we use BrainTap. I use it in the clinic, and I encourage people to get their own app and do them. So I use BrainTap almost daily. I actually did 2 20-minute meditations this morning. But it's all about just calming that nervous system down and letting it relax. And once you develop the habit of doing it, there's a lot of therapy that comes from guided meditation. And again, we use BrainTap. I use it at home. I use it in the clinic. I have multiple stations in the clinic where people are doing BrainTap. They're doing therapies.